What is an empty sac at 6 weeks, and is it normal?
Hello, and welcome. Today, we are going to discuss an important topic in early pregnancy called the empty sac. We'll discuss what it is, when it is typically seen, and whether it's a normal finding at 6 weeks.
What is an empty sac?
An empty sac, also referred to as an anembryonic pregnancy or a blighted ovum, is a condition that can occur in early pregnancy. It is when a gestational sac forms and grows, however, it is empty, meaning there is no embryo inside. This is usually detected during an early ultrasound scan. This sac can be seen on an ultrasound by around 5 weeks gestation, but it's not unusual if an embryo isn't visible until around 6 to 7 weeks.
Is an empty sac at 6 weeks normal?
Seeing an empty sac at 6 weeks can be normal, but it can also suggest a couple of things. Firstly, it could mean that the pregnancy is just earlier than initially thought, which could happen if ovulation occurred later in the menstrual cycle. If the pregnancy is indeed earlier than expected, waiting a week or two and doing a repeat ultrasound can reveal the presence of an embryo. Secondly, it could potentially indicate a blighted ovum. In a blighted ovum, the fertilized egg attaches itself to the uterine wall, but the embryo does not develop. Cells develop to form the pregnancy sac, but not the embryo itself. However, it's crucial not to jump to conclusions. Medical professionals usually recommend a follow-up scan after a week or so before making a definitive diagnosis.
What are the causes and implications?
Most commonly, a blighted ovum or an embryonic pregnancy is caused by chromosomal abnormalities in the fertilized egg. This could be a random event and does not necessarily indicate a problem with the parent's chromosomes. A blighted ovum typically results in an early pregnancy loss or miscarriage. However, it's important to note that experiencing a blighted ovum or early miscarriage doesn't decrease the chances of having a successful pregnancy in the future. So, to sum up, while an empty sac at 6 weeks can be a normal finding if the pregnancy is simply earlier than anticipated, it could also suggest a condition called a blighted ovum. However, a definitive diagnosis should only be made after a follow-up ultrasound. If you have any concerns about your pregnancy, it is always best to consult with your healthcare provider. We hope this video has been informative and helps you better understand the concept of an empty sac in early pregnancy. Remember, each pregnancy is unique, and it's crucial to stay informed and consult with healthcare professionals as needed.